Recording live from the Northeast Georgia Business RadioX studio, this is Northeast Georgia Business Radio. Welcome again, folks. I'm your host, Tom Sheldon, recording from the beautiful Empower College and Career Center of Jackson County. I have with me today an amazing guest, Miss Shana Shoden. Did I say it right that time?
You got it right.
Shana, it is. Shana, how are you?
I'm doing well. How about you?
You know, I'm always good. I get to talk to a microphone. I love it. It's awesome. But you are with MedLink Georgia.
That's right.
Tell me a little bit about MedLink.
Well, MedLink Georgia is a nonprofit medical provider. We're a community health center, and we partner with our patients and our communities to support wellness through compassionate and quality health care.
I got you. So, financial situation, it just doesn't matter. You take care of people.
Yes, that's our goal, is to make sure people have access to good quality health care. So while we do accept insurance, Medicare, Medicaid, we also have a sliding fee scale. It's based on family size and income. And that's available to people who are either uninsured or underinsured. Gotcha. Our goal is to make sure everybody's got access.
That's awesome. So I guess that's the MedLink Georgia mission.
Yes, it is. It is.
To provide health care to those who need it.
That's correct.
Awesome. I want to know just a little bit about you, Shana.
All right.
Give me just a little bit of background about you. How did you end up in this amazing organization that serves the Northeast area?
Well, I grew up in Louisiana, but I went to work for another organization and had an opportunity to live in a number of states and work in a number of states, and one of them was Georgia.
Awesome.
I got transferred out of Georgia, and a number of years later, we decided to come back. MedLink really piqued my interest because of the focus on what the organization has and how we work with our communities.
Gotcha. I know MedLink is different from other medical providers, but let's hit on some of the more important ones.
Well, we talked about one of the primary ones. We are a nonprofit.
Right. A nonprofit. That stands out immediately.
Right. So we're nonprofit. The insurance piece and being able to work with people who are in different situations and still need good quality health care. We also are working to do a number of different things in our communities. For example, one thing we have is we have a school-based health center that I work with, and that's based on meeting the needs of students, teachers, and school employees. It's right there on a school campus, and so far we just opened last fall.
Congratulations.
Thank you, and very excited about it. It's going well, and hope that we can expand it in the future.
I was about to ask you something that may be expanded.
I very much hope so. I think that there's
great.
Definitely an opportunity.
You're doing it right on campuses?
Yes.
In the schools?
It's not in the school, but we have a building on the campus.
On the campus.
Right.
I got you. Right next door. And that's here in Jackson County? Where is that at?
No, this is in White County.
Okay. A little farther north?
A little further north is one of the counties that I work with.
Yeah, bring it south. It sounds
Yep.
great.
Yep.
It sounds great. But you're not I don't want to say the word discriminating, but you're not turning people away because maybe they can't afford what they need.
Oh, absolutely not.
I love that.
Yeah. No, that's really our goal, is to make sure that people do have access to all of the different types of medical care we provide.
Right. If anyone listening to this, if you don't get, or if you just get one thing out of this entire podcast, realize the work that MedLink Georgia is doing. They're welcoming everyone through the door.
Yes.
And giving them the care they need. And I'm betting, and I'm not putting words in your mouth, but I'm betting you're not turning people out because the money ran out. You're taking care of those people.
That's correct. If somebody doesn't have insurance,
right.
If there's an inability to pay, we're not going to turn anyone away.
That's awesome. I think we need more organizations like y'all, to be honest with you.
Thank you.
I'm serious. I'm dead serious. So, what kind of services is MedLink Georgia providing? I mean, you're not just prescribing something for a common cold. You're doing a lot of serious work for the community.
We are. So if you look at the services, the medical services that we provide, we were established back in 1979 under what's called the Rural Health Initiative Program.
Okay.
And we've really stayed true to the roots of that by focusing on support and health care in Northeast Georgia and rural areas. So often they're very underserved. So the medical pieces that we do, we have primary care, we have pediatrics, podiatry, we do occupational health, women's health, we have imaging, we do a number of support services like our pharmacy. We've recently started dental as well that we have. We also offer behavioral health, diabetes, awareness, nutrition counseling in person and through telehealth.
I was about to ask if you provide any type of education, but you just talked about the diabetic side of things and awareness.
Yes.
Education and awareness. That can be just as important as the actual care itself. So you do provide things like that?
Yes, we do. Yes, we do. And because we recognize that often people aren't either able to travel in for all of these services or, there's limitations for them to be able to get in to see us, we do offer those via telehealth as well. So, so you've got an option.
Do you see that growing in the future, telehealth?
I believe so. Telehealth can be used for so many things in the medical world, and especially when you're talking about more rural areas where you don't have as many physical locations. It makes sense to be able to offer more things through telehealth.
I got you. You mentioned 1979. So did COVID affect y'all? I know we're pretty much out of COVID, right? That was 3 years ago, but did that throw a wrench into things?
Well, it certainly changed the way we all, went to work, how we did things, and so forth. But it also gave us an opportunity to educate people. We're still doing education around COVID vaccine, for example.
Right.
In that, if you haven't had a vaccine since September, you should probably have another one.
Right.
So it certainly changed day-to-day operations and how people had to do things.
Right.
But it also, I think, gave us an opportunity to be creative and look for new ways to do things.
Yeah, and that's a takeaway that I've always gotten from going through COVID and everything is it forced all of us to think just a little bit differently.
Yes.
Because we all get complacent, right? I mean, we do. We're creatures of habit. But no, we had to get creative. So good to hear the part about the education and providing to rural areas that there just isn't the resources. Thank goodness for that.
It is, and that's
thank goodness for what you're doing.
Well, thank you, and it is a big part of what I do every day. So we have the clinical side, but then we have the outreach activities that we do, and we really have a myriad of things that we do. I mean, if I think of some recent things that we have done, we've got drive-through food pantries. We have diaper days where we give away diapers and other similar
small
supplies.
Events, more or less.
Yes.
At your locations.
No, these are typically in different cities, different towns, different events.
So you're taking it to them.
Yes.
Oh, that's amazing.
Yes.
See, stuff like that is so often no one knows about it. All that's awesome. That's a lot of good stuff. Wow, you guys are cool.
Oh,
I'm sorry. I don't want to say I'm speechless. I'm never speechless. Those who know me know I'm never speechless. But that is so much you're giving back to the communities.
Mm-hmm. Well, and we try to
that's overlooked.
And we try to make sure that we're addressing the needs of multiple age groups and multiple situations that people may find themselves in.
Right.
So the idea is, if you look at our vision, healthy individuals, healthy families, healthy communities.
Right.
So
Community thrives.
Yeah, exactly. So that's really what we're focused on doing, and it can include things like hosting free flu and COVID vaccine clinics. It can be
More
vision
education.
clinics.
More education.
Yes, yes, and we can do vision clinics where people can, have an eye exam and have their get glasses. We also do stress management classes for teens and for seniors. We have a couple of those coming up in the near future. So, always excited about being able to listen to the communities and be able to provide what's needed.
I got you. How do folks know that you're in their community or coming to their community? How do you spread the word?
Well, we work with a number of partners
Okay.
within all of our communities, and so through those partners, we share what we're doing, and sometimes we're doing that in conjunction with them. We may be doing it in partnership with them.
I got you.
On top of that, we use social media, and we use sort of that face-to-face as well, where I visit different locations and make sure people.
The boots on the ground, the personal relationship. Social media is great. We do a lot. Business RadioX does a lot with social media, obviously, but boots on the ground, that human touch, that relationship, you can't beat it.
Right, and so you can work with different communities, different businesses. You can I've spoken to people in all kinds of situations and talked to them about, hey, we've got this coming up next Friday, or whatever we may be doing, we can discuss that when we're out in the communities.
Do you have anything coming up soon?
I do. I have.
Let's plug some stuff. I'm serious.
And we do have a working with Jackson County Schools tomorrow night for one of their family fun nights. We also have some spring health events coming up. In the first one is in Cleveland in White County.
Okay.
So as I said, I work in 5 of the 26 counties that we work in. So there are other people who have my role, and we all have opportunities to be out there. One thing I did last weekend was provided planting materials, so seeds and potting soil and so forth, so people could start their own victory garden. And
nice.
That really is in support of healthy nutrition.
Yeah, wow, you can't beat that. There's some folks local here in Jefferson that do very similar with the gardening, and we'll talk off air about that. Maybe we can get you all together. That might be pretty cool. The service. I want to go back to the services for just 1 second. MedLink Georgia does provide some mental health services.
Yes, we have behavioral health.
Okay.
If
you mentioned that earlier, forgive me, it went past me.
Yes, we do.
I think it's very important.
It's critical.
It's so easy to overlook that.
It is.
If you can't use your arm, or you broke your leg, that's pretty obvious. Or if you see someone limping, something's wrong. But mental illness, I have a nephew who is a addiction counselor. He does heroic work in my view. I'm biased. He's my nephew, but so many times, so many people are suffering, and we just don't know about it. But MedLink Georgia takes that on.
Yes, we do. It's unseen.
Yeah.
As you said,
it's easily hidden.
Yes, it's easily hidden, and often people don't really want to talk about
exactly.
that. And so that's why our approach, or from my perspective, my approach is to identify where are there opportunities. For example, we have end of the year school exams coming up.
Right.
Would that be a great time to talk to people about test taking strategies and how to manage stress during that time? So we've got a couple of events scheduled around that. We've spoken to people during the holidays. Sometimes that's a very tough time
for a lot of people. But again, easily hidden.
Yes.
Oh, it's Christmas. It's Thanksgiving. Everyone's happy. They're not.
That's true. And and our behavioral therapists do a great job of being able. They can meet with people one-on-one. As I said, they can do it in person or via telehealth, and really help people get the support that they need.
So you work with therapists. You have therapists.
Yes, we do.
That reach out to the community.
Yes.
Oh, okay. Well, that's important for the folks to know. I mean, it really is. It really is. Forgive me. I try hard not to be ignorant, but when I see med in front of anything, right away I think of, okay, I feel like I have the flu. I'm going to go in, and they're going to write me a prescription. The doctor's going to see me for 3 minutes, and I'm out the door to get a prescription filled. But you folks do so much more than that. So much more than that.
Yes, and I mean
It's not even the tip of the iceberg of what you do.
No, because it's we are primary care, but we offer a number of specialties on top of that, and up to and including, as I mentioned, imaging and so forth. It's so many of our communities are in somewhat of a medical desert where they really don't have access to care.
Right.
So, for us, it's always better to be able to give preventative care, to give information, to give resources to people so that they can live their healthiest life.
That's awesome. That's awesome. Talk about champions of healthcare. I have one sitting across the table from me. Very cool. Shana, how can the folks get to know MedLink Georgia? Is there a website? How do they go about that?
Yes, we have a website. It's medlinkgeorgia.org, and the medlinkga.org.
I was about to ask, it's GA, not spelled out Georgia?
Yes, it's GA.
medlinkga.org.
Okay. And there you can find all of our 26 locations. You can see information about and pictures of all of our medical providers. You can read about the history, of course, of MedLink, and about our vision and our mission.
That is so cool. Folks, go to the website, and keep in mind if you have a need, or maybe you know someone who can or has a need, and they're afraid, hey, I just don't have enough money. Oh, hey, I can't afford that. MedLink Georgia is there for you. I'm not putting words in your mouth, am I?
No.
Okay, good. That's what I want to hammer home, is that you folks are there for the community. Shana, thank you for coming in.
Thank you.
That wasn't so hard, was it?
Not at all.
All right. My music's there somewhere. I don't hear it yet. Oh, there it is. When they play the music, I got to go. Thank you for listening, folks. I'm Tom Sheldon. This is Northeast Georgia Business Radio.